Hi everybody, my name is Makalio Tovio. I'm 34 years of age and I'm from Sydney, Australia. I've been suffering lower back pain, leg numbness now for the last, say 12 to 18 months. I've been suffering, I've had leg numbness in this leg for close to 12 months. And for probably the last 6 months, I've been feeling numbness and not too much pain, just numbness in this foot and this upper lower part of my leg. I can't walk properly. I can't walk unassisted. I need crutches to walk around just to keep balance. Every time I take a step, I feel as if I'm falling over, and there's also sharp pain in my lower back and on the side of the hip as well. So I've been suffering this, like I said, for the last 12 to 18 months, and it's been a pretty big burden on my life. I've got 3 young kids as well that I've been, missing out on their life.
Hello, my name is Taleo Tovio and I am Makalio's wife. Mark has had this injury for a long time, for the past year, and it's been very hard for myself and my kids, our 3 children, to watch him go through these emotions the past year, not being able to provide for his family, stopping work in June in Sydney, Australia, and then just watching him deteriorate over time. It was no quality of life for him, as he was also missing out on a lot of the activities with our children. He wouldn't go anywhere. He would stay at home. He'd be bedridden. And a lot of the time, we missed him because he would be at home when we'll be out doing things with the children.
I've been doing all sorts of treatment from where I am in Australia and Sydney, and to no avail. I haven't made too much progress until I started doing some research on surgery abroad and medical treatment abroad, and I stumbled across Dr. Maichand. Dr. Ashwani Maichand here in Delhi, India, and he works out of CK Birla Hospital, and it's been an awesome experience.
So this was a very unique case of spine surgery, and the uniqueness was in the sense that cervical spine stenosis generally happens in elderly people who are 50 plus or 60 plus. In a young patient at the age of 33, cervical spine stenosis and such a severe stenosis, and the location of the lesion. Stenosis generally happens at C5-6, C4-5, C6-7, but this was at C7, D1 and D2. This was the unique type of case that we have seen. Generally, means in my career I have never seen a young patient suffering from such a severe stenosis at this level. And the risk involved was, one, this is the tightest part of the spinal cord, spinal canal. In cervical spine there is ample space, in lumbar spine there is good space, even in dorsal spine, lower dorsal spine, the diameter is good enough. But this upper dorsal spine is very, very tight. And the implication is that when we operate, we cannot afford to go wrong even by half a millimeter. So we have to be very accurate, otherwise patient will have complications like paraplegia, weakness in the legs, chances of loss of bowel and bladder, which can be very difficult, especially considering my patient's body weight. It would have been very difficult to manage him. And we explained everything, in fact. But we were able to manage it. We were able to deliver a good result. How? Number one, my patient's willpower. He never lost hope. He trusted us. I'm very thankful to you. And I'm thankful to my hospital also, who provided me the best equipment which was required for this case. Had we been doing this surgery with manual equipment, manual instruments, there were chances that we could have damaged the cord and there could have been deficit. So a specially ordered diamond tip burr was available with us, a small burr which has diamond tip. The advantage is that it is very accurate and it stops once the bone is finished. It basically grinds the bone to powder and we can slowly approach our area of interest without causing any collateral damage. So all these, and of course my team is well versed with such cases. We have been doing such cases over the years, and they were able to provide me all the help that was required. So this is the summary of the case. We had difficulty, we were able to overcome. The difficulty was not only surgical but also medical legal, because he's from a different country and there are so many implications if something goes wrong. Of course, we are always careful, but this type of surgery, you can have problems. So I'm very thankful to all my team, to my patient, to my hospital for such a great outcome.
So yeah, coming over to India has been a life-changing experience, a blessing. As you know, Mark actually found Dr. Ashwani Maichand via CK Birla Hospital online, and from there he started doing his research. This was about 6 months ago, and you know, he said to me, he said, if we have enough money, we can go over to India and we can fix my problem. And then he was just worried. He never thought in his life that he would come over to India and fix his problem. You know, he didn't want to spend money on himself. He wanted the money to go to the kids, our 3 children. He would rather spend it on other kids, not himself. But just between myself, my kids, and his parents as well, you know, we wanted him back, and we wanted him to get that quality of life back for himself. So nothing else mattered to us. And so we did it. We made the leap of faith, as you can say, and came over here to India. It was unfortunate that no one in Australia could help us, but given the circumstances and the technology that we have here in India and at CK Birla, they were able to obviously help Mark with his situation, go through the surgery. Traveling from overseas is a bit scary. It can be scary, but it's very, very rewarding if you do your research. Mark has done his research with Dr. Ashwani, and I think having that digital footprint helps online as well to put people's mind at ease. So that helped us a lot. And when we got in touch with the team here at CK Birla, they were very helpful. Any questions that we had, they were able to answer them. You know, like, what will we do when we come there? We can't speak the language. They said, no problems, everything will be sorted for you every step of the way. So from the airport, all our transfers to and from the hotel to the hospital, very professional manner. And then when we came to CK Birla Hospital, everything was taken care of for us. Dr. Ashwani is a very professional doctor. He is very, very capable. He's very knowledgeable, very experienced doctor. And he told us, when he first told us that Mark was actually misdiagnosed back in Australia, it was a big shock to us. And he helped us to understand why. He showed us the scans and everything like that. So it was great with everything that we had heard. Then he told us about the risk, how it had changed from a 98% to about a 50% risk. Now this made the surgery high risk because obviously Mark is not your typical patient. He's a big boy, and you know, there's a lot of risk with where the surgery actually happens. So cervical spine surgery is where he ended up getting the surgery, and the Dr. Ashwani and everyone here at CK Birla did let us know about these risks, and we were happy to take that risk, only because Mark had ticked all the boxes back in Australia and nothing had helped with his situation. None of the pain went away, and he still had pain at that time. So we thought we'd take the risk. And we trust in Dr. Ashwani. He has a lot of videos online that you could see. And we thought, you know, we'd come here all this way and might as well take the risk rather than go back and think whether it all would have worked or not. But yeah, so during Mark's surgery, he had the surgery, everything was successful. Straight away, Mark finished feeling the pain. There was no pain after surgery. And also he started moving his toes and started getting some kind of feeling in his feet. Nonetheless, he has no more pain and everything is a lot better now. And the aftercare, I must mention the aftercare and the hospitality that were showing from the nurses, the housekeepers, everyone, all the staff. They were very personable with Mark, and they were very patient. They listened to, whatever. If they seen he was uncomfortable with anything, they would always ask if he was okay. Everyone was very lovely, very professional in the way they carried themselves here at CK Birla. And I must say the facilities, such as even the bathrooms, the way, the cleanliness, everything here at CK Birla, and as well as the technology that was used during operation, it's second to none. And we're very, very grateful. Our family and our children back in Australia are very, very grateful to all the doctors, all the nurses, all the staff here at CK Birla for helping Mark give his life back. So thank you.